This is Dr. Stamato. I think that what I would say about testing is that at this time we have the tests that we need to treat patients who are acutely ill in the hospital. We have enough tests to test patients who come to the emergency room, patients who need to be admitted. We have enough tests to test our healthcare workers and our first responders. And we have enough tests to test those members of the community that the Campbell County Department of Public Health asks to be tested to do their tracking and testing of contacts. And so we are meeting the needs that the Wyoming Department of Health tells us we need to meet right now. I think that the separation of testing really is in terms of care. And right now we have adequate testing for care and for helping to do the epidemiology that the Department of Public Health does.
And one thing I guess I want to emphasize is, because I've personally gotten some feedback from patients that I wasn't tested and therefore I couldn't be treated. Well, there is no treatment for COVID-19 other than to stay at home and let your immune system do what God intended it to do, which is help you heal through this process. Very, very sick patients are admitted to the hospital, and so that really is just to observe them, and in some cases across the country, you've seen patients on ventilators. You've heard the cry in New York City for more ventilators. That is really the last-ditch effort to help a patient with their breathing and respiratory system. Having said all that, there's still no treatment, really. So the treatment is to stay home, and so the testing doesn't change. Our mantra here is testing doesn't change the treatment. I think that's important for the public to know. There's no magic pill we give you when we find out you have COVID, other than to say stay home, and if you get really bad, very short of breath, call 911, and there's a possibility you would be admitted to the hospital.
Sure, and I think for many of us, this is a subgroup of diseases, of problems we see. So what COVID-19 is a viral infection, a viral pneumonia when it causes pneumonia, or a viral infection, just like any other virus. And just like any other virus, for the vast majority of them, the treatment is to treat your fever, stay hydrated, and rest. For this one, we would add to keep isolated so that it's not spread as widely as it otherwise might be. And that's true of all the other viruses we treat. There are very few viruses for which we have a specific treatment and that actually require that treatment. So for many times, if someone was seen in the emergency room and the diagnosis of viral infection was made, that patient would be treated in that way, and the same is true for this. The decision-making as a doctor is really more about how the patients are evaluated, what their clinical condition is at the time they're seen. If they are very, very ill, then they do get admitted to the hospital. Mostly when it's pneumonia, just for oxygen treatment, and nowadays that can be even done at home. So the lack of testing is a slight change in how we see this in the broader picture, but for most viral infections, we don't do tests to see what the name of the virus is, because it does not change what we do or how we treat someone. The testing for this is really more of an epidemiology question to help people understand how many of us are getting this infection and how it might be spreading. Its real use at this point is in the very sick patients and in public health, helping to try and limit the spread of it.